Experimental drug reduces cortisol levels, improves symptoms in Cushing's disease. A new investigational drug significantly reduced urinary cortisol levels and improved symptoms of Cushing's disease in the largest clinical study of this endocrine disorder ever conducted. Results of the clinical trial conducted at Centers on for Continence appear in New England Journal of Medicine and show that treatment with pasireotide cut cortisol secretion an average of 50% and returned some patients' levels to normal. Cushing's disease is a rare disorder, with 3 to 5 cases per million people. It can affect all ages and both genders, but is most common in otherwise healthy young women, says Beverly M.K. Biller, MD, of the Massachusetts General Hospital Neuroendocrine Unit, senior author of the study. Often misdiagnosed, Cushing's is associated with a broad range of health problems, causing physical changes, metabolic abnormalities, and emotional difficulties, and if not controlled, significantly increases patients' risk of dying much younger than expected. One of several conditions that lead to Cushing's syndrome, chronically elevated secretion of the hormone cortisol. Cushing's disease is caused by a benign pituitary tumor that oversecretes the hormone adrenoccorticotropic hormone, inducing increased cortisol secretion by the adrenal glands. Symptoms of Cushing's syndrome include weight gain, hypertension, mood swings, irregular or absent periods, abnormalities of glucose processing, insulin resistance, glucose intolerance and type 2 diabetes, and cardiovascular disease. Since those symptoms are associated with many health problems, physicians may not consider the rare possibility of Cushing's. The diagnosis can be difficult to make and usually requires the expertise of an endocrinologist. Since cortisol levels normally fluctuate during the day, a single blood test probably would not identify chronic elevation, so the most common diagnostic test measures a patient's 24-hour urinary output. First-line treatment for Cushing's disease is surgical removal of the adrenoccorticotropic hormone, secreting tumor, which can lead to remission in 65 to 90% of patients who are treated by expert pituitary surgeons. But symptoms return in 10 to 30% of those patients, requiring repeat surgery, radiation therapy or treatment with drugs that interfere with part of the cortisol control system. Until last month, there was no specific FDA Food and Drug Administration approved medical treatment for Cushing's syndrome, and while the newly approved drug mifepristone should benefit some patients, it does not affect the pituitary source of the condition or reduce cortisol levels. The current Phase 3 trial of pasireotide, the first drug that blocks adrenoccorticotropic hormone secretion by binding to somatostatin receptors on the pituitary tumor, was sponsored by Novartis Pharma and enrolled 162 patients at 60 sites in 18 countries. Almost 85% of participants had either persistent disease that had not responded to surgery or had recurrent disease. The other 15% were recently diagnosed, but not appropriate candidates for surgery. Participants were randomly assigned to 2 groups, one starting at daily 600 microgram injections of pasireotide, the other receiving 900 microgram doses. 3 months into the 12-month trial, participants whose urinary cortisol levels remained more than twice the normal range had their dosage levels increased. During the rest of the trial, dosage could be further increased, if necessary, or reduced if side effects occurred. At the end of the study period, many patients had a significant decrease in their urinary cortisol levels, with 33 achieving levels within normal range at their original dosage by month 6 of the trial. Participants whose baseline levels were less than 5 times the upper limit of normal were more likely to achieve normal levels than those with higher baseline levels. And the average urinary cortisol decrease across all participants was about 50%. Many Cushing's disease symptoms decreased, and it became apparent within the first 2 months whether or not an individual was going to respond to pasireotide. Transient gastrointestinal discomfort, known to be associated with medications in the same family as pasireotide, was an expected side effect, but the investigators observed elevated glucose levels in 73% of participants, something not seen to the same extent with other medications in this family. That will require close attention, since many Cushing's patients already have trouble metabolizing glucose. Biller explains, Those patients who already were diabetic had the greatest increases in blood sugar, and those who were pre-diabetic were more likely to become diabetic than those who began with normal blood sugar. However, elevations were even seen in those who started at normal glucose levels, so this is real and needs to be monitored carefully. Additional trials of pasireotide are in the works, and a Phase 3 study of a long-acting version of the drug was recently announced. Biller notes that the potential addition of pasireotide to available medical treatments for Cushing's disease would have a number of advantages. It's very important to have medications that work at different parts of the cortisol control system, which is the case for the currently used medications that work at the adrenal gland level. Pasireotide, which works at the pituitary gland, and mifepristone, which blocks the action of cortisol at receptors in the body. Having more options that work in different ways is valuable because not all patients respond to one medicine and some may be unable to tolerate a specific drug's side effects. As we have more drugs available to treat Cushing's, she adds, I think in the long run we may start using combinations of drugs, which is the approach we use in some patients with acromegaly, another disorder in which a pituitary tumor causes excess hormone secretion. Ultimately, we hope to be able to give lower doses, leading to fewer overall side effects, but that remains to be determined by future studies. Biller is a professor of medicine at Harvard Medical School. Exercise 6.1. Answer the following questions. 1. What drug is discussed in the text? What effect does it produce? 2. What is known about Cushing's disease? 3. What are the symptoms of this disease? 4. Why is it difficult to diagnose the disease? What is the most common test performed? 5. What role does cortisol play in the development of Cushing's disease? 6. What is the treatment for Cushing's syndrome? 7. What trial was performed to check the effectiveness of the drug? Did the drug prove its effectiveness? 8. Does the drug produce any side effects? 9. Why are several options of medicine needed for the cure of the disease? Exercise 6.2. How do you understand the following phrases from the text? Explain their meaning. What synonymous words or phrases can you substitute these phrases with? Write down your own sentences to exemplify these phrases. Otherwise, healthy young women, treatment with pasireotide, urinary output, first-line treatment, benefit some patients, disease that had not responded to surgery, transient gastrointestinal discomfort, additional trials of pasireotide are in the works. Exercise 6.3. True or false? Examine the statements provided and determine whether each statement is true or false. Justify your response by citing specific references from the assigned readings, ensuring your explanation is clear and supported by evidence. 1. Cushing's syndrome is caused by excessive production of cortisol in the body. 2. The most common cause of Cushing's syndrome is long-term use of corticosteroid medications. 3. Cushing's syndrome primarily affects children and adolescents. 4. Weight gain, particularly in the abdomen and face, is a common symptom of Cushing's syndrome. 5. Elevated blood pressure is not associated with Cushing's syndrome. 6. Cushing's syndrome can cause thinning of the skin and easy bruising. 7. Cushing's syndrome is often characterized by excessive hair growth on the body and face. 8. Surgical removal of the tumor causing Cushing's syndrome can often lead to a cure. 9. Pharmacological treatment is the first-line approach for all cases of Cushing's syndrome. 10. Medications called glucocorticoid receptor antagonists can be used to block the effects of excess cortisol in Cushing's syndrome. 11. Ketoconazole is a medication commonly used to reduce cortisol production in Cushing's syndrome. 12. Somatostatin analogs are effective in treating Cushing's syndrome caused by pituitary adenomas. 13. Mifepristone, a medication used in medical abortion, can be prescribed off-label to treat Cushing's syndrome. 14. Pharmacological treatment alone can cure Cushing's syndrome. 15. Medications used to treat Cushing's syndrome can have significant side effects. 16. Pharmacological treatment of Cushing's syndrome is always successful in normalizing cortisol levels. Exercise 6.4. Provide a brief definition for each of the following terms and discuss them in pairs, Polycystic ovary syndrome, epigenetics, D-N-methylation, histone modification, microRNAs, hyperandrogenism, oocytes granulosa, Thecus cells, epigenetic. Markers cumulus cells, histone loci, locus.